Hi, welcome to my channel. This talk on finasteride contains all the questions and answers I have been asked over many years. Questions related to finasteride, its usage, its side effects, its alternatives, and what are the blood tests required to ensure that you do not fall prey to the side effects of finasteride. Still, if there are any more questions that you have in your mind, do drop a comment below and I'll be happy to answer in subsequent videos. So during the lockdown for COVID, I had a lot of spare time and I thought might as well experiment with patients who are hesitant to take finasteride. So I selected 10 jittery patients who were petrified with the very thought of taking finasteride, and I gave them placebos to take, which they took for about 3 months, and I asked them to jot down the effects that they got. You would be surprised to note that almost all 10 patients had some sort of erectile dysfunction or the other. There was also one patient who had so much of side effects that he wanted to stop the drug just after 3 days of having started it. So this is how your mind rules your body. So I only have this to say that I do not have any benefit from any company to talk about finasteride. I just do hair transplant. I do not have any other avocation whatsoever. These talks about finasteride are meant to facilitate the patient whom I treat, because taking or not taking finasteride is a huge decision on the part of my patient, and I wish to, through my talks, facilitate this decision making in my patient who opts for a hair transplant or who opts for various other treatments for hair loss. You would see that none of my talks I would mention the trade name of finasteride, except if there were a direct question posed to me. Otherwise, I restrict myself to the generic name. I try my best to give only evidence-based, verifiable information to my subscribers. This present talk is not meant to scare. It is meant to inform. It is meant to facilitate my patients to do their research properly about the drug finasteride and take a decision which is born out of research, rational thinking, and not merely hearsay. Many patients presume that finasteride in all cases causes side effects. Now, this assumption is so far from the truth. Finasteride has been with us for over 40 years. Around 39 million patients over these 40 years, if not more, have been on finasteride, and it is a mere 0.5 to 1% of patients who report side effects. Side effects, chief of which in their mind is loss of libido. Now, these are such minuscule numbers if you see the benefits of finasteride in hair loss. But most patients would believe those 39 patients who have filed lawsuit against the company Merck for erectile dysfunction. Now, this is great disservice to this drug, which is overall a very safe drug to take. And moreover, because most of the patients who are going to fall prey to these side effects can be determined through intense counseling and through blood tests. Yes, I agree, finasteride is not for everybody. Everybody cannot take finasteride. So these patients who are susceptible to the side effects of finasteride need to be weeded out before you plan a patient's surgical hair restoration or you plan the patient's hair loss treatment. And if you see this in the backdrop of the incidence of erectile dysfunction in 25 to 35-year-old males, you would be surprised to note that up to 50% have some form of erectile dysfunction or the other. So knowing this will allay the anxiety of a lot of patients before they take finasteride. Well, this is a question I've been asked so many times. Several times I've been asked, doctor, for your baldness, for your degree of baldness, do you yourself take finasteride or not? I do not shy away from this question. Well, I have had 2 hair transplant procedures. The first one was an FUT procedure, and the second one in 2012 was an FUE procedure. Knowing fully well that since my donor area is now depleted, if I wish to maintain the hair that I have on my head, including the transplanted hairs, since I'm over 50 now, I need to take finasteride. And I have been taking finasteride 1 milligram on alternate days because that is the dose which suits me for the past 7 years. Finasteride is a 5-alpha reductase inhibitor. Finasteride works by inhibiting 5-alpha reductase, which is responsible for the conversion of testosterone to its active metabolite, that is DHT, dihydrotestosterone. Finasteride was first used to treat hypertrophy of the prostate. It is only later that the benefits of finasteride for hair loss were discovered, and it is also now used widely the world over. Probably more than prostatic indications, it is used in hair loss today. According to the American Hair Loss Association, patients who take finasteride are able to significantly decrease the progression of baldness in 86% of cases. And in 65% of the cases, there is regrowth of hair at the 1 year mark. No, this is not true. Baldness is of varying severity. How you respond to finasteride, how much balding you have, how aggressive your baldness is varies from person to person. And so does the percentage that finasteride will benefit you while treating your hair loss. An average patient has 86% benefit in stopping the onset of baldness. In others, it could be 50% or a mere 40%. But benefit there will be. It is important to note that finasteride is not a cure for baldness. It does not eliminate the gene of male pattern baldness. What it merely does is it acts as a shield, a protective umbrella, a barrier from the ill effects of DHT on the hair follicles. This is the primary action of finasteride. The moment you remove finasteride from your hair loss treatment protocol, the hair which have been sustained or maintained by the action of finasteride will be soon lost. So you can expect an 86% stabilization of your hair loss after starting finasteride at 1 year. However, this effect of stabilization of hair loss continues to diminish over the 5 years after starting finasteride, and it may go down to as much as 65% of stabilization of your hair loss. Whereas finasteride helps in blocking type 2 isoenzyme of 5-alpha reductase, Dutasteride blocks all 3 isoenzymes of 5-alpha reductase. Therefore, Dutasteride as a drug to block DHT is more potent. Up to 94% blockage of DHT happens with Dutasteride as compared to only 70% due to finasteride. For some people, the 90% maintenance of hair and 5% risk of side effects is more acceptable than 70% maintenance of hair with 0.5 to 1% risk of side effects with finasteride. This is why some people who are robust in mind and who have the risk-taking capability prefer Dutasteride over finasteride because the effect it produces is more than that of finasteride. It goes without saying that with this added benefit of hair regrowth and stabilization, the risk of side effects is also proportionately higher with Dutasteride. If the hair shaft diameter has not shrunk by up to 50% of its original hair shaft diameter, regrowth of this hair by finasteride will happen. Finasteride does not regrow lost hair. So, in a slick bald patient, finasteride is of no use. What is the exact dose of finasteride for hair loss? Well, I don't know. Why? Because it is just like throwing spaghetti on a wall and observing how much spaghetti sticks. So the amount of finasteride that is required for a particular person varies because of your individual metabolization, your bodily needs, and your extent of baldness and the speed of baldness. Most patients benefit by 0.5 to 1 milligram finasteride taken daily. After hair transplant, there is no playing around with the dosage of 1 milligram per day for 6 months to support the new roots which have been planted. Some doctors, however, advise a dosage of 0.5 milligram finasteride only on Mondays, Wednesdays, and Fridays. However, this dosing of finasteride is controversial. According to the dose response bell curve, this dosage or this sweet spot lies between 0.8 milligram to 1 milligram a day. Well, there are outliers who benefit by even 0.3, 0.5 milligrams in a day, but they are very few and far between. So most people will benefit by zero point 0.8 to 1 milligram per day. There is no advantage in taking more than 1 milligram every day in male pattern baldness. Propecia and Proscar both have the same ingredients, that is finasteride. Whereas Propecia is US FDA approved for hair loss, Proscar is US FDA approved for prostatic conditions. There are many patients of hair loss who prefer taking Proscar instead because it is far cheaper than the hair loss medication Propecia. Yes, you can take Proscar instead of Propecia. Why? Because it's the same salt. The only thing is that it comes in 5 milligram packing, but you can split it into 4 equal parts and use it every day or as recommended by your doctor. You can do this splitting by means of a pill splitter, which is freely available in the market. Proscar is far more pocket friendly than the medicine Propecia. So therefore, many patients, especially in the Western world, who find the cost of Propecia exorbitant, they prefer to use Proscar split into 4 pieces. The salt used in Propecia and the salt used in generic forms of finasteride is the same. However, what we need to note here is that there are more than one polymorphic forms of finasteride, and this determines the cost and the efficacy of the finasteride that you use. This polymorphism can affect the solubility, the stability, and the melting point of finasteride. These different polymorphic forms of finasteride may have varying effects at the cellular level, so therefore it is important to choose your finasteride carefully. Patients who report at an early age and have extensive baldness need to take finasteride for a long period of time. This is in contrast to patients who report after 35 years, in whom the balding is stabilized. They need to take finasteride for a lesser period of time, but most patients need to take finasteride for as long as they value their hair, for as long as they love their hair. Well, this is a very simplistic statement, but is the essence of truth in the dosing of finasteride. You need to take finasteride till the time your baldness gene switches off. Well, yes and no. If you are young with higher grade of baldness, which is aggressive, you may need to take finasteride for a longer period of time as compared to a person who's 35 and has only a hairline problem, who in contrast needs to take finasteride only for as less as 6 months. So there is considerable variation in the period of time for which you have to take finasteride, and it depends from person to person. Well, it goes without saying that Propecia, the world over, is the most sought after brand of finasteride. The half-life of finasteride is 6 to 8 hours. If it were an antibiotic, the doctor would have told you to take it 3 times a day. However, the effect of this finasteride lasts longer because there is a buildup of tissue levels of finasteride, and the tissue half-life of finasteride is 30 days. It takes up to 3 months for a patient to see the benefits of finasteride on hair, and it is up to 1 year that the maximum benefit of finasteride for your hair loss will be experienced. We all know that hormones are secreted into the body in a cyclical fashion according to the circadian rhythm. This spike in testosterone levels occurs early in the morning. So if we take finasteride at bedtime, the peak of finasteride and the peak of testosterone level in the body match with each other, and this helps us in inhibiting the effects of DHT better. I am not an advocate of starting finasteride before the age of 21 years, even though US FDA has approved the use of this drug for males above 18 years of age. This is because I feel that balding before 21 is generally very aggressive, and finasteride fails to rein in the ill effects of the male pattern baldness gene if it happens before the age of 21. I'm also very chary in starting this drug at such a tender age because mostly parents are very anxious when this drug is used at a much younger age. So personally speaking, this makes me feel very uncomfortable. So I do not prescribe this drug before a person is 21 years of age. It does not matter what time you take it, before the meal or after the meal, finasteride will have equal effectivity. Heavy alcohol intake, say for example more than 60 ml of whiskey, is deleterious to the effect of finasteride. Yes, once in a while binging is fine, but taking it on a regular basis will negate the effect of finasteride on reining in the effects of DHT. If you are habitual to use of alcohol in the evenings, it is better to switch over to taking the drug in the early morning. Yes, finasteride is US FDA approved for males above 18 years for treating male pattern baldness. Though finasteride is not US FDA approved for use in female pattern baldness, this is an off-label use of finasteride in women. Increased 5-alpha reductase activity has been found on skin biopsy in females with androgenetic alopecia. Generally, women who are young benefit by 1 milligram of finasteride a day, like in most men. But as she becomes postmenopausal, the recommended dose is 2.5 milligrams in a day. At the outset, I would like to mention that customized dosing of finasteride or tailor-cut regimes are meant only for hair loss treatment, not after hair transplant. After hair transplant, it is mandatory to take 1 milligram finasteride every day for 6 months. For other indications, there are various customized dosings. There are various tailor-cut regimes that suits a person's metabolism, his mental hardiness, his risk-taking ability, and his level of baldness. Now, this is closely assessed by the treating physician and monitored from time to time as the patient's balding develops over a period of time. It is very interesting how crowd behavior has evolved the dosages, the dosing patterns, the regimes, the protocols of finasteride over a period of time. There are various permutations and combinations of finasteride, various frequencies, various microdoses, macrodoses, switch off, switch on, and various supplementation with other DHT blockers that are in vogue. However, it is important to start the patient on the minimal effective dose that will benefit him, which has the minimum probability of giving him side effects, whereas at the same time, maximum maintenance of his hair, maximum regrowth of his hair over a prolonged period of time. Therefore, no one dose will benefit all patients. There is a need to customize the dosage, the regularity, the frequency of finasteride depending upon various factors. And this is where a doctor steps in. This is because compliance on finasteride is crucial. If you stop finasteride, it will negate all the benefits of finasteride that you have experienced over the last few months. And many people do stop in response to what they hear from people, in response to what they read on the internet, most of which are myths. So different clinics follow different regimes which best suit their practice. We have seen that many of these protocols, these regimes, the frequency of taking finasteride does not have much scientific basis or clinical propriety. But still, the patients report good hair maintenance, they report good hair regrowth, and therefore, over the years, these doses have been encouraged by various clinics. So it all boils down to the experience of the clinic, the metabolism of the patient, the aggressiveness of baldness in the patient's risk-taking capability, and his hardiness of mind that matters. Well, many patients buy a cheaper Proscar instead of the more expensive Propecia and split this Proscar, which is 5 milligram, into 4 pieces by using a pill splitter. Now, this pill splitter causes fragmentation and powder formation. So every day you end up taking fragments which may vary from 0.9 milligram to 1.3 milligram. So every day you're surprising your body with different doses. This is a very widely followed treatment protocol in many patients in Western countries where the cost of Propecia is exorbitant. Yes, this is the basis of my switch off, switch on treatment using finasteride. Finasteride over a period of time builds up in the body. Though the half-life of finasteride is 6 to 8 hours, its half-life in the tissues is 30 days. So when you stop finasteride, it takes up to 60 days for it to be completely cleared, completely flushed out from the body. So to prevent this piling up of finasteride at the tissue level, which may be responsible for side effects of finasteride, I am a strong proponent of stopping finasteride for 15 days after continuous 3 months of being on finasteride. This is a way to minimize side effects of finasteride in my practice. Increasingly, many doctors have started prescribing finasteride in micro doses, that is 0.5 milligram on Monday, Wednesday, and Friday. Any dosing pattern which gives a respite to a patient from his worst fears is music to his ears. So these clinics play up or pander to the worst fears in the patient's mind about finasteride, and they taper down the doses to a dose which is acceptable to the patient. Many times it may be expedient dosing of finasteride. The National Center for Biotechnology Information in its paper informed that a dosage of up to 0.2 milligram taken daily may be as effective in controlling male pattern baldness as compared to higher doses of finasteride, and at the same time it eliminates all the side effects of finasteride. However, most of us in this practice who have tried various doses, or who have had so many patients who have tried various microdosing forms of treatment, know very well that such low doses have no salubrious effect on the progression of baldness in most cases. So these minuscule dosing regimes are mere expedient dosages of finasteride. The other drawback of taking finasteride 0.5 milligram only on Monday, Wednesday, and Friday is that it does not cover the spike of testosterone levels which happens over the weekend. So this is a great drawback of this microdosing of finasteride on select days. After a hair transplant, finasteride is beneficial for regrowth of the planted hair only in the first 6 months. So this small window period does not allow any scope for experimentation. So microdosing after a hair transplant has no role to my mind. The cost of finasteride varies based on what brand you use. It also varies on which country you are in. It also varies depending upon whether you're using generic finasteride or you're using trademarked finasteride. In India, trademarked good quality finasteride costs as low as $3 per month, whereas in the United States of America, it can go as high as $80 per month. Changing from one brand to other can cause a period of intense shedding. Why this happens is because of varying polymorphic forms of finasteride that exist. Many people take topical finasteride alone or in combination with minoxidil. However, you need to note that the penetration of the skin barrier is so low that adequate tissue levels are not built up to prevent the deleterious effects of DHT. I have seen that after 2 to 5 years of using finasteride, the effect begins to wane, and this happens in up to 40% of my patients. So this is the time when I like to supplement this regime with once a week 0.5 milligram dutasteride. Dutasteride taken in this dose helps in better maintenance of hair, helps in better regrowth. It complements and supplements the use of finasteride. At the same time, the intense side effect of dutasteride is not a problem because it is being taken only once a week. Dutasteride has been in use only for 5 years as compared to 40 years of finasteride. Therefore, I feel more safe by treating my patients with finasteride with supplementation of dutasteride taken once a week. It is always better to err on the side of caution than to regret later. Finasteride also increases the amount of estrogen in your body after you start taking it. So rather than stopping your testosterone patch it is better to consult your doctor, get a laboratory workup done, get your testosterone levels tested and your estrogen levels tested, and then in consultation with the doctor, you can modulate the treatment that you're on. You can even think of removing the testosterone patch. You should consult your doctor and he may consider to put you on an estrogen inhibitor, and the most commonly used estrogen inhibitor is Arimidex. However, it has to be taken in consultation with your doctor because it is not an over-the-counter medication. It is a medication you have to take with utmost care. Well, we do not use a blowtorch to light a candle. Exhibiting the body to dutasteride may be a dangerous thing to do because dutasteride comes with significant side effects. It is always better to start with finasteride, low doses of finasteride, build up the doses of finasteride if the patient does not respond. And if the effect of finasteride over a period of time starts to wane, we can consider supplementing it with once a week or twice a week dutasteride. If it still does not help, we can start with dutasteride taken every day. There are many patients who benefit by daily dutasteride and have minimal side effects whatsoever. However, starting with dutasteride is not a very pragmatic thing to do. The makers of dutasteride, GSK, GlaxoSmithKline, are little hesitant in applying for US FDA approval, what with the bad press that its counterpart Propecia received. So they know very well that if they apply now, they are not going to get US FDA certification or US FDA approval. This is the reason GSK has not applied for US FDA certification in spite of the many superior benefits of dutasteride in hair loss. There are many patients who are taking dutasteride the world over and benefited tremendously out of it. Countries like Japan and Korea have even approved the use of dutasteride for hair loss. But it will be some time before US FDA and other countries, seeing the immense benefits of dutasteride and low rate of side effects in most patients, goes ahead and certifies its use. Cold turkey is a very commonly used term in the West. It refers to stopping a drug or a substance suddenly without tapering it off. So when a substance is stopped suddenly, a patient develops yearning for that substance and also develops a lot of goosebumps on his skin. These goosebumps are similar to the cold turkey lying in your refrigerator. And hence, when you stop the drug finasteride suddenly, you refer to it as cold turkey. Well, the half-life of finasteride is 30 days. So that means that after 60 days of stopping finasteride, the body completely flushes the tissue levels, the tissue stores of finasteride, and the body is completely drug-free by 60 days after stopping finasteride or after going cold turkey. The crown exhibits lower DHT levels than elsewhere in the scalp, and hence this observation. Also, when a patient comes for hair loss treatment, he comes generally when the hairline has started to efface itself. This is the time when the crown has just begun to thin. The hair shaft diameter in the crown generally is above 50% of normal. So when you initiate this patient to finasteride, because the hairline has been effaced but the crown hasn't, it's just started to thin, it is normal for the patient to notice and report that the hairline has not benefited as much from finasteride as his crown has. For a quantitative assessment of the benefits of finasteride, we have various ways to measure the hair shaft diameter. Hair shaft diameter before starting finasteride and hair shaft diameter after starting finasteride. However, more important is your observation of the effects of finasteride. You will be the best person to tell us that you are feeling good about yourself after having started finasteride. This can also be judged by taking periodic pictures in the same setting, in the same surrounding, in the same lighting, every 15 days or every 30 days after starting finasteride. And you will realize how finasteride has benefited you over the last few months. I am quite hesitant in starting finasteride at the age of 18 or 19, even though it is USA FDA approved at the age of 18. This is because if hair loss occurs at 18 or 19, it is going to be very aggressive. No matter how much finasteride you give, no matter when you start finasteride, this finasteride dose is not going to rein in this aggressive nature of balding. Also, this is the period when the secondary sexual characteristics are not yet complete. So I am very chary at this stage to interfere with the hormonal milieu of the patient. The parents also are very hesitant in starting the patient on finasteride. Their parents also are a bit hesitant that finasteride is started. This keeps me from starting finasteride before the age of 21. Finasteride changes brain chemistry. It is known that patients who have been taking liquor, finasteride interferes with the brain's capability to make neurosteroids, which are responsible for the urge to drink alcohol. Finasteride changes brain chemistry. Finasteride interferes with the brain's ability to manufacture neuropeptides, which are responsible for the urge of drinking alcohol. So this loss of interest is a commonly reported symptom after starting finasteride. Finasteride is contraindicated in a few indications. 1. Patients with aggressive prostate cancer, male patients who have had breast cancer, in male patients with liver problems, male patients with suicidal thoughts or suicidal ideation, patients with allergy to 5-alpha reductase inhibitors, and women who are either planning a pregnancy or are pregnant or are breastfeeding the child. Yes, in some patients who report that the effect of finasteride has started to deteriorate. In some cases, after a few years, the effect of finasteride on hair loss begins to reduce. In these cases, I start them on Dutasteride once a week and then I gradually increase the dose. Shedding is very frequent after starting finasteride. It happens for about 1 to 2 months before the benefits of finasteride set in at 3 months after starting it. This shedding lasts only for about 1 to 2 months. No, this does not affect the benefits of finasteride on hair loss. Saw palmetto is a very weak DHT blocker. Yes, by all means take it if it benefits you, but do not think that it is an alternative to finasteride in the first 6 months after a hair transplant. Very early in the course of your taking finasteride, you will realize whether you fall in that 0.5 to 1% of cases who have noticeable side effects. And then if you decide to continue to take finasteride, you can derive solace from the fact that people have been taking it for as long as 10 to 15 years without any noticeable side effects. For that matter, Donald Trump has publicly stated that he has been taking finasteride for the last 25 years. When you start finasteride, we start it at a very low dose. Unless of course it's after a hair transplant when low doses are not recommended. So when you start the medicine in low dose, you see the effectivity over a period of 3 months, 6 months and 1 year and scale up the dose of finasteride. Many times you have to increase the frequency, increase the dosage and sometimes supplement it with Dutasteride once a week or twice a week. There are patients who do not respond to finasteride after 2 to 5 years. In these patients, gradually the drug is replaced by Dutasteride. So what is recommended is the minimal amount of dosage, which will give you the maximum results, maximum stabilization of your hair loss, maximum hair regrowth, at the same time minimizing side effects from finasteride. So the strategy should be to start low and then scale up. Finasteride does not cause cancer. There's a big mix-up here. Finasteride decreases the sensitivity of detecting PSA levels. So this interferes with the detection of prostate cancer. It is not that it causes cancer. It only masks the detection of prostatic cancer by inhibiting the prostate-specific antigen enzyme, which is used as a test for detection of prostate cancer. Finasteride, by its very effect, is decreasing the amount of DHT in the body. Therefore, in a sense, we can say that it is prostate protective. So it does not cause prostate cancer. Minoxidil and finasteride have different mechanisms of action. Whereas minoxidil is a stimulant, it increases blood flow by vasodilatory effect on the blood vessels. Finasteride is a DHT blocker, which blocks the conversion of male hormone testosterone into its active ingredient DHT. The effect of finasteride being stronger than minoxidil, when you stop minoxidil and start yourself on finasteride, you have to be prepared for a period of shedding. No, this does not happen. The beard does not thin out after starting finasteride because finasteride blocks only 70% of the DHT. You can take my example. I've been on finasteride for almost like 7 years now, and I have a beard which is growing lush by the year. So I do not think that that finasteride has any ill effect, any deleterious effect on the growth of beard hair. Unfortunately, there is no alternative yet to finasteride. There are many drugs, there are many treatments coming up in the horizon. I have done a video on this in my talk titled "The Future is Here." So you might reference to that, but there is no alternative yet to the use of finasteride. When you stop finasteride, many people think that their baldness has increased. Well, there has been some period of time, say 2 to 3 years since you've been taking finasteride, and suddenly if you stop it, you will notice that the baldness is more than what it was 3 years back. So here you need to note that baldness is progressive. Over those 3 years, your baldness has progressed. It is the finasteride which is masking the progress of your baldness, which is sustaining your hair, which is regrowing your hair, and the moment you stop finasteride, the baldness level will go back to what it would have been without your having taken finasteride. It has been noted that in 40% of patients, after 2 to 5 years, the effect of finasteride begins to decrease. This can be due to two reasons. One is that baldness being progressive. At some stage of life, the baldness becomes accelerated, and that is the time you feel that the effect of finasteride is not keeping pace with the level of baldness. It can also be due to upregulation of the hormones in your body. That is, the finasteride that you're taking, the body develops resistance by upregulation. The response of the androgen receptors to the effect of decreasing levels of DHT is balanced by upregulation. Finasteride blocks 70% of the DHT, Dutasteride blocks 90% of the DHT. We do not block 100% of DHT because DHT has much more important functions for the body than just causing hair loss. Mostly tablets are enteric coated with a film to prevent the action of gastric acid on them or to avoid dissolution of the drug in the stomach. Also at times to prevent the ill effects of that drug on the lining of the gastric mucosa. However, in finasteride, the very idea of film coating or enteric coating of the drug is to avoid contact because finasteride can very easily be absorbed through wet skin. This is to avoid unnecessary contact in those who are handling the drug, and especially at home if a pregnant woman or a woman who's planning a pregnancy handles the drug with wet hands unknowingly, because there is a very remote possibility of this drug causing birth defects. Since hormones in the body are secreted in cyclical fashion, there may be short periods of increased hair loss while on finasteride, even though there is long-term stabilization of hair loss and regrowth of hair. So many patients get disappointed very often. Yes, like any other medicine, any other allopathic medicine, finasteride also is not without side effects. The commonest side effects noted by patients are tenderness in the breast, tenderness in the testes, cognitive symptoms, decrease in libido, decrease in ejaculatory volume, suicidal ideation or suicidal thoughts, and depression. These side effects, as earlier explained, depend on a host of factors. Number one is the concomitant presence of erectile dysfunction, the concomitant presence of increased levels of estrogen when you start finasteride, lack of mental robustness, underlying depression. Interesting fact to note here is that in the age group of 25 to 35 years, the most common age when people are taking finasteride, even in those who are not on finasteride, the incidence in this population of erectile dysfunction is as high as 40 to 50%. So this most feared side effect of finasteride has to be seen in that background. However, the side effects of finasteride are seen in a very little percentage of patients. Nearly 0.5 to 1% of the population taking finasteride experiences one or the other side effect. All these side effects do not appear together. It is not that all 0.5 to 1% will have erectile dysfunction. That 0.5 to 1% might just have a tender nodule in the breast or little pain in the testes. So therefore, the chances of getting erectile dysfunction are far less. The side effects of dutasteride are more than those of finasteride because dutasteride blocks up to 94% of DHT. Therefore, the side effects are 5%, whereas finasteride blocks only 70% of DHT, and therefore the side effects seen are 0.5 to 1% only. Also to note here is that the half-life of dutasteride is 4 to 5 months. Many times by deep counseling, by spending time with the patient, we can predict whether this patient is going to have side effects of finasteride or not. In my practice, I have seen that after counseling, after some lab work, I have been able to detect all the patient groups who will experience side effects after taking finasteride. What is needed here is to spend time with the patient, to start finasteride in low doses and detect side effects, if any, early in the period of taking finasteride. I also have the benefit of my switch on, switch off technique of exposing the patient to finasteride. In this regime, I stop finasteride for a period of 15 days after 3 months of regular intake of finasteride. What this does is it washes off excess accumulated amounts of finasteride in the tissues. And this decreases the chances of a patient landing up with side effects. The patient who has high levels of estrogen in his body and who's overweight is advised to exercise. Exercising decreases the estrogen levels in his body. It is also seen that by regulating your diet, you can decrease levels of estrogen in your body. Cruciferous vegetables contain a higher amount of DIM, that is diindolyl methane, and this regulates estrogen levels in the body. You can also take supplements like ginseng and other aphrodisiacs. Many patients also find respite by taking tadalafil, sildenafil. Over a period of time on finasteride, you might note that the effect has started to wane, that you've started noticing adult acne, hyperactive sebaceous glands, increased oiliness of the skin, chronic telogen effluvium, and an inflamed scalp. These are the signs that the body has stopped responding to finasteride, and it is increasing the levels of DHT in the body by upregulation. And this is the reason why most of the DHT should not be blocked when using DHT blockers. And this is an answer to those who want to increase the doses of dutasteride and finasteride, trying to block most of the DHT in their body. A deep counseling is a must. We need to rule out that patient group who is likely to have side effects due to finasteride. A person who is very obese, a person who is hypogonadic, a person who has suicidal ideation, suicidal thoughts, and a person who has pre-existing erectile dysfunction needs to be weeded out. These are not the right candidates in whom you should start finasteride, and as a corollary, in whom you should do a hair transplant, especially if they are coming to you at a younger age group with extensive baldness. When you're on long-term DHT blockers, it is very essential to take a break of 15 days after every 3 months on finasteride or dutasteride. What this does is it washes off excess levels of dutasteride and finasteride in the tissues. This buildup of excess levels is also postulated as one of the reasons for side effects of finasteride and dutasteride. Cognitive abilities are affected in a small percentage of patients taking finasteride. Patients experience lightheadedness, fogginess after starting finasteride. The side effect of cognitive function is not so much that it prevents you from driving. Yes, you can drive normally after you are on finasteride. There is no problem taking finasteride in those who are diabetic, whether the diabetic status is controlled or not controlled. Yes, arimidex is the most commonly used anti-estrogen, and many times people who are professional bodybuilders and professional athletes and who are on finasteride and have higher levels of estrogen are advised this drug so that they can have optimal athletic performance. However, this is to be taken under strict medical supervision because there are certain side effects of arimidex which can be very distressing. There are side effects in women too. In women also, finasteride can decrease libido. It can cause depression, suicidal ideation, suicidal thoughts, and cause enlargement of the breast size, tenderness of the breasts, and other rare side effects. Since finasteride causes sexual side effects, there are a host of myths linked to the effect of finasteride on the male organs. There's a myth that it causes shrinkage of the penis. Well, finasteride cannot cause shrinkage in the size of the penis because the size of the penis is determined by the effect of DHT on the male organ during the growing years, that is during puberty and early adolescence. After this period is over, finasteride, if exhibited, does not cause shrinkage of the penis size. Yes, there are many instances in which people who are on testosterone supplements are also taking finasteride. But in these cases, because both of them increase the testosterone levels in the body, you have to take these drugs under supervision. Frequent monitoring of blood levels of testosterone, of blood levels of estradiol are important, and your doctor will advise you how to regulate the doses of testosterone and finasteride in your body. Finasteride is not known to cause headaches or migraine. Due to the fact that finasteride is not absorbed well through the skin, it cannot build blood levels of finasteride to sufficient amounts to cause erectile dysfunction, which is a rare side effect as it is of oral finasteride. Yes, there is surely a huge amount of psychological overlay when you experience side effects from finasteride, and this is not helped by the excessive exposure that finasteride has got over a period of time on the internet. In many countries, those on finasteride cannot donate blood till they are 30 days off finasteride. Many times patients experience side effects like erectile dysfunction early on while taking finasteride. This side effect over a period of time, as the body adjusts, disappears. And most of the side effects disappear at 1 year. Once you stop the drug, the side effects go away after 60 days because the half-life of finasteride is 30 days and it takes about 60 days for the tissue level build-up in the body to be washed off. Yes, it is true that in 2012, FDA mandated that the label for finasteride for propriety should carry the message that the side effects of finasteride may continue and may be permanent after you stop its use. However, this was more in response to the legal battle that Merck is fighting. But this goes against scientific evidence and common sense, since the levels of finasteride in the body are completely washed off in 60 days or at the most 90 days after having stopped it. So when there are no levels of finasteride in the body, the persistence of sexual side effects, ascribing the sexual side effects to finasteride seems to be quite inappropriate. Most of these patients are those patients who have concomitant existence of erectile dysfunction, which is very common in the community. And these patients were not counseled properly, they were not assessed properly, their blood work was not done. They should, in the first place, never have been exposed to finasteride. The absolute contraindications for the use of finasteride are hepatic or liver problems, prostatic cancer, males who have had breast cancer, those with suicidal ideation, with depression, suicidal thoughts, patients who have allergic reactions to 5-alpha reductase inhibitors, and lastly, in men and women who are planning a family and in women who are breastfeeding their child. Finasteride in some cases is known to cause decrease in the semen volume and cause temporary infertility. Therefore, it is a category X drug. Also, it is mentioned in the label of Propecia that there is a rare chance of birth defects. Therefore, before planning a family, it is advised the male partner should stop finasteride 60 days before planning the pregnancy and remain off it till his partner is pregnant. This gives a lot of peace of mind to the doctor as well as to the couple who are planning a child. It is seen that women who are premenopausal respond well to 1 milligram finasteride every day. However, women who are postmenopausal respond to no less than 2.5 milligram daily dosage. This is because of the 5-alpha reductase activity, which is more in women who are postmenopausal. Yes, taking finasteride after your partner becomes pregnant is very safe. Though the drug is labeled as a category X drug for pregnancy, the semen amounts of finasteride are so low, up to 20 nanograms per milliliter, which are grossly insufficient to cause any side effect. It has been mentioned by Merck that the drug can pass into the body of the female through the semen. It can also pass into the body of the female by handling drugs, especially those which are crushed with wet hands. So, for the peace of mind of the couple and of the doctor, it is important that the patient should not be exhibited with finasteride for 60 days before the couple plans the pregnancy, and even after that, the woman should not handle finasteride. And later, when the lady is breastfeeding, she should not be exposed to finasteride. If the female is taking finasteride, she should stop it 60 days before planning a child, and she should not take it till she breastfeeds the child after childbirth. Finasteride causes 15% increase in the level of testosterone as well as in the level of estrogen in the body. Therefore, it is important to have a baseline parameter, to have a baseline value of blood levels of these hormones, estrogen, testosterone, and even DHT before starting the patient on finasteride, so that if, God forbid, the patient has a side effect, there is some report, there is some level we can refer to and modulate the doses accordingly. If the testosterone levels are high to start with, taking finasteride can further increase the levels of testosterone, and this excess level of testosterone by a process of aromatization can be converted into estrogen. The blood tests which are most commonly done are total testosterone, free testosterone, DHT levels, and estradiol levels, and also free androgen index. Doing these levels is quite controversial because it is not the amount of testosterone or estrogen or DHT which alone is important in causing baldness or in preventing hair loss. There are other factors like sensitization of androgen receptors to DHT. the level of DHT in the tissues, and this, since it is determined by genetic expression, which is different for different individuals, there is a wide variation of how patients respond to finasteride and how patients respond to increasing and decreasing doses of finasteride. And this is a very complex field, and therefore the doses of finasteride, dutasteride, and other hair loss medications should be regulated only with the supervision and the assessment of a competent doctor. Of all the testosterone that is circulating in the body, only 3% is free testosterone. It is only free testosterone, which has a small molecular size, which can cross into tissues, that is important. Therefore, total testosterone is not of much value. It is the amount of free testosterone circulating in the blood that is more important than total testosterone. Your DHT levels may be normal, but you have baldness because the sensitivity of the androgen receptors, which is determined by genetic expression, which varies from person to person, is what determines your level of baldness and what determines your getting baldness even with minimal amounts of DHT. So high DHT levels will not relate with the level of baldness. Though DHT levels may not be very conclusive as far as the level of baldness is concerned, they do help us in weeding out patients who are hypogonadic and in regulating this medicine over a period of time in the years to come. The normal level of testosterone is 280 to 1100 nanograms per deciliter. Anything below 300 indicates that further testing for hypogonadism should be done, and that is done by an endocrinologist or an andrologist. Though it is noted that the zinc levels in the scalp in patients who are balding are low, it is only very low or extreme deficiency of zinc that is known to cause baldness. So increasing zinc levels has not been correlated with decreasing the amount of baldness. Zinc is known to be a weak 5-alpha reductase inhibitor. In the end, I would like to state that doctors prescribe finasteride and other DHT blockers based on their experience and based on their protocol which they have devised over many years. Especially if you're young, time is running out. So it leaves very little time for experimentation of various drugs, various potions, lotions, and various concoctions before you home down to a particular product. Most of the patients get carried away by expensive concoctions, and this is their undoing. For the hair once lost during this experimental phase cannot be regrown. That is a loss forever. So this is what many patients do not understand, and this is where a competent doctor steps in to guide you through your hair loss, to offer to you evidence-based medical treatments and not overhyped treatments available by the dozen, by the scores in the market. With each passing week that you're worrying, with each passing month that you're experimenting with a new drug, time is running out. The hair that you're losing will not come back. With each passing month, you're coming closer and closer to doing the bald man shave off. So listen to your doctor. He is advising you medicines, cheaper medicines in your best interest, the medicines which are evidence-based and in his experience will get you through, will stabilize your hair loss for a longer period of time. Thank you for watching, and if you liked my video, do let me know, and if there are any questions, please leave a comment below. Thank you for watching, and God bless.